One day, in a village, as two children were saying they wanted some fish, an older boy with some fish was passing by. The children asked him for some fish. And he gave them some from his basket. The children were delighted and cooked the fish, but before too long they were finished. A few days passed. When the older boy came by once again, the children asked for some more fish. The older boy said he had no more fish, but gave the children fishing rods instead. The children dipped their lines into the water. It didn't take them long to catch some fish, and they were well pleased. But soon their fishing rods broke, and they could no longer use them. The children decided to borrow some more fishing rods. But the older boy said he had no more. The children were worried they could no longer catch fish. A few more days passed. As the children were talking about wanting fish, another older boy from a neighbouring village came walking by. "What's the matter?" he asked. "Let's talk together about how we could catch some fish." As the older boy looked on, the children discussed what to do. "We want some stronger fishing rods," they told the older boy. The older boy replied, "Even if you get a new rod, it might break again, and then you won't be able to eat." The older boy saw the children were disappointed and said to them, "Why don't we try together to make a fishing rod so we can get some more fish?" Together with the older boy who had lent them the fishing rods, they all went to find a fisherman. The children and the two older boys discussed with the fisherman how to make a fishing rod. It took a long time, but the children didn't give up, and they eventually finished the job. Now, even if their fishing rods broke, the children knew how to make a new one. Now they could keep on fishing without any help at all. Tanzania developed due to its ideal position as a base for the exploration of East, Central and Southern Africa. Tanzania's population of 34.45 million is composed of people from some 130 ethnic groups. Tanzania is known as one of the most stable countries in East and Southern Africa. It is economically stable, with a GDP growth rate of 6.3% in 2004. However, with its population of almost 40 million, accumulated external debt of approximately $6.6 billion, and poverty which is focused in agricultural regions, the country also has significant assistance needs. Action is also required to address HIV, AIDS and malaria, Tanzania's leading causes of death. In Morogoro, Tanzania's second largest region by area, 5.4% of all adults have contracted HIV/AIDS. The disease is the leading cause of adult mortality. The leading cause of infant mortality is malaria. 1 in 5 children does not survive to see their 5th birthday. The Morogoro Health Project was implemented over 6 years, from April 2001 to March 2007, through the combined efforts of the Tanzania Ministry of Health and Social Welfare, the Morogoro Regional Government and JICA.
The project has achieved in giving capacity to the managers, both at regional level and district level. But the most important achievement is to get the people involved in their own problems, in identifying their own problems, in planning with the district, the council health management teams, so that together they can sort out the problems identified. Now, this was not happening effectively before. After the project, that has been achieved, which I think is an extremely important achievement.
Since the 1990s, Tanzania has actively implemented efforts to reorganise and strengthen its governmental administration through the introduction of sector reform programs. To resolve community health issues, health workers must hear problems with their own ears and see problems with their own eyes. They must develop the management capability to think together, plan together, act together, and monitor and evaluate together with the community. The project focused on Morogoro as a model region and targeted the Regional Health Management Team and the Council Health Management Teams, which are responsible for the overall administration of 304 health and treatment facilities in the region. The project aimed to achieve evidence-based district health management that could accurately address various community health problems. Therefore, the project implemented comprehensive measures for the personnel development and organisational strengthening of regional health services, including the rebuilding of health information systems, sharing and integration of experiences and information, and the improvement of the capacity to analyse health problems through the introduction of operational research. The health system relies on the joint operations of central and district authorities. The system's success depends on the ability of its management. The project did not simply provide systems and tools, but rather provided support for capacity building to aid self-development. It encouraged health managers to consider how they could use the tools provided, how they could improve work efficiency, and how they can apply the new technologies and policies to the actual situation in the community.
Morogoro Health Project has achieved a lot. One is it has improved the skills in management of the health management teams. They can now plan better, they can implement their plans better, and they can do supervision, monitoring and evaluation. But also on top of that, they can do research. That is a very important issue, that now their plans are evidence-based.
Japanese project members avoided giving direct instructions and orders. Instead, as all parties worked together to resolve problems, the project fostered the capacity of each individual and of the organisation, and promoted the autonomy and self-development of the health service system as a whole. To achieve these goals, the project was divided into 4 basic activities. One of these activities was capacity building through basic and applied management training. The second activity was the formation of 7 working groups, and regular meetings were held which included trainee representatives to promote capacity building and actually develop useful management tools. Examples include the creation of a health yearbook for the Morogoro region, the creation of operational research reports and reflection of those reports in health plans, and assistance for the construction of resource centres and the subsequent integration of resources in each region.
Each output has a working group. Actually, we went up to 7 working groups. These were very instrumental in implementing the project. So what did they do? They did things like, first of all, we were trained in, apart from general management, we were also in leadership, we were also trained in computer skills, knowledge and skills. We were trained in how to do research, we were trained in how to plan, and we were trained how to keep the database. And in doing this, in the process of doing that, we came out with some achievements.
The third major activity was the provision of assistance for the use of new capabilities in daily work. The Morogoro Health Project was not simply about training, but about using the results of training in the workplace. The project provided support for the sharing of information, experiences and capabilities to realise improved regional health services. The fourth principal activity was the sharing of experience and information with other related parties. For example, the project provided support for regular joint meetings of region and district officials and for project members to visit other regions and districts to speak about their own experiences. This in turn gave participants the confidence to plan and implement health activities. The funding required for the project is not only provided by JICA. The regional and district governments are gradually increasing their funding levels. In 2006, 28% of the project's budget was incorporated into annual district health plans. The project has achieved autonomy and continuity by building a network for the use of local resources that includes health and treatment facilities, universities and research institutes, private companies and the central government in the Morogoro region. This next section introduces 3 counterparts who worked in different working groups. Mr. Samson Mweta, a district officer for Uranga, is responsible for vaccine storage and distribution as well as managing the health information system.
I was empowered through training by MHP to allow me to conduct my work or to plan, implement my work efficiently.
Mr. Mweta is making a report on the collection and analysis of data at health and treatment centres. Data is collected from each facility every quarter. The district inputs the information onto a computer. The data is then analysed and the results are submitted to the regional government and fed back to health centres so they can use it for planning their activities. How did Mr. Mweta acquire his management abilities?
First is through training. I received different training, different management training. Second, I achieved this knowledge through participation. I always participate in those activities, those planned activities in my district. Basically, before this training, before this exposure, my management skills was inadequate. But after being exposed in these activities, in this training, I managed to change my management style by learning how to share experience with the others, how to work as a group, as a teamwork in my district. I also learned how to involve community members or different partners in the health system delivery in my district.
How did Mr. Mweta work together with the Japanese specialists?
Our relationship is that Mr. Goto is my technical advisor in radio calls and Duha. He always advises us how to run these facilities in a better way, and we do supervise together with Mr. Goto, sometimes in our dispensaries and health centers, and he gives support if necessary. Yeah, technical support.
仕事してきて、やっぱりようやく彼らがこれは使えると自分たちにとってようやく分かってきて、でそれがなんとか彼らの方でちゃんとこれからね使ってくれるんじゃないかという期待を持ってます。
I enjoy my work. After being empowered by these skills, now I can participate in different planning, different district planning, and I'm the member of our district health planning team. That's why I enjoy. It is different from before this project. I didn't know how to start, how to plan, how to evaluate, but now I'm somehow competent. I'm enjoying because I feel that I am now empowered to do my work properly.
Mr. Justin Bundu described his involvement in the establishment of an information resource centre.
The society is the place where people get various services like reading books, borrowing books, photocopying services, and internet services. They are available. We decided to start the resource center after seeing the needs of our staffs. Most of our staff need references of various professionals, and also they needed to get experiences, lectures from different books. So after that, seeing that needs, we decided to establish a resource center.
In 1995, Mr. Bundu borrowed specialist books and hired a room to support the establishment of a resource centre in response to the demand for a place for health professionals to continue their education after graduation. However, at the time he had no management experience and the service did not continue. In 2002, having decided to re-establish a resource centre, Mr. Bundu negotiated with senior district officials and developed a plan to repair a building and open a new resource centre using the district budget. MHP provided management training and support for operational management, and the new resource centres opened in 2004 and 2005.
I have improved a lot because I have also the management. Because in my basic training, I've never been trained on resource center skills or management. But during this MHP project, I've been trained on also management of resource center. That's a very big change from my knowledge, my basic knowledge.
How did Mr. Bundu work together with the Japanese specialists?
There's a very big relationship between I and Marisuda, our supervisors. Especially we get technical support or advice on how to manage and how to learn resource center activities. And even computer skills when during typing several documents or publications, especially posters and leaflets for advertising our resource center.
経験とか情報の、 共有ということは、もともとカウンターパートの方から出ていた、要望で、私たちがしたことっていうのは、その彼らの要望に、耳を傾けてどういうふうに実現していったらいいかっていうのを、彼らと共に話し合いながら作っていったということです。
How has Morogoro Health Project changed, Mr. Bundu?
It makes me change because as far as leadership, I am able now to manage my staffs, to supervise them, and to read them, to explain how to do their works. Also communication, now I am able to communicate with the other district to know what they are doing in their district and what they differ from our district.
Mr. Bundu appears to be enjoying his work.
Yeah, I'm enjoying because now we are working as a team. Different from the previous days. Now we are communicating with our fellows, sharing experiences, sharing ideas with different districts. So we are enjoying working together as a team, as the whole region.
1 year has passed since the opening of the resource centre. The benefits of the centre are starting to show as the health professionals and students who study there begin to achieve promotions and better grades. Ms. Mary Nzoa is a municipal nursing officer. During the project, she was a member of the Operational Research Working Group, participating as a counterpart in a range of activities, including regular meetings and opinion exchanges with local residents.
There is a lot of changes, in fact, in terms of skills. We gained through Morogoro Health Project. We undergo different trainings. So through that trainings, we obtain the knowledge and skills too. So after getting that knowledge and skills, so we are changing our attitude. Maybe in our working places, in doing our daily activities. So our attitude also changed through Morogoro Health Project.
At the Operational Research Working Groups, representatives of various districts in the Morogoro region engaged in vigorous debate. For Ms. Nzoa, participation was a useful experience.
Basic data analysis, advanced, etc. You remember we started since yesterday. Let us go to Romances. Everybody will have to open Roman. The working group meetings is very useful because we share experience, we exchange ideas, and it's very, very useful interactions between our members.
Ms. Nzoa used the skills she acquired through the operational research activities to work as a facilitator for a focus group discussion that constituted one of the health centre's qualitative surveys. She listens directly to the centre users' opinions on health services.
And through the experience, through the knowledge gained, through the skills gained, so automatically we changed our behaviours. So on my side, we managed to change behaviours, the attitude through the Morogoro Health Project.
日本人専門家として、あるいはカタリストとして、私が一つの小さな刺激になろうということですね。なんで刺激が必要かと言いますと、変化を求められているということですね。新しいマネジメント能力を身につけるということを求められています。その中で、一つ大きいのは、チャレンジすること、挑戦することというのが一つ大きくなってきますので、そのチャレンジをするために何か、日本人専門家がサポートするわけなんですが、そのエンカレッジする、あるいはファシリテートするということで一つの刺激となって、そのサポートを行っているわけです。
Ms. Nzoa provides feedback to the Morogoro City team to share operational research information from the meeting of district representatives. On the weekend, Ms. Nzoa goes out into the field to do work including report writing. She says that it helps her to improve her skills.
I'm enjoying because have a confidence on what am I doing through the experience gained, develop my capacity to conduct my daily activities or my duties as a manager as well.
Those knowledge and skills which we got from you as our catalysts have made us to get courage to continue doing our work.
The Morogoro Health Project, to me, actually has opened our eyes towards knowing, for example, the kind of diseases that our people are suffering from.
実は私たち日本人がカタリストとして技術支援を行ってきたところが私たちのプロジェクトの大きな特徴です。共に寄り添って共に考えて共に解決していく、そういうようなカタリストというような触媒となってタンザニアの地域の保健マネージャーの人たちの能力強化を継続的に行うことによってタンザニアの人たちが自立発展ができるように、自分たちで継続的に事業を展開できるように、同時にキャパシティデベロップメント、自分たち組織それらの能力を自分たちで継続的に発展できるようなに支援してきました。ここはすごく大きな特徴だと思っています。
The children who learned to make their own fishing rods grew up and got married. Soon they had a child, and they watched her grow too. One day, the little girl said to her parents that she wanted some fish. "Let's think together about how to make a fishing rod," her parents replied. It took a long time, but the little girl kept trying, and soon she was able to make a fishing rod by herself. The other villagers were watching. Soon they began to talk to each other and help each other to develop different ideas for fishing with various fishing rods. The villagers, the village chief, and even the fish were all delighted.